I'm a big fan of organoids, and one of the reasons is that when I treat a patient, usually what we do is we give chemotherapy, you do a scan after 2-3 months, and then you see whether it worked or it didn't work. So in an ideal world, you should be able to test patients up front, either by cell lines or organoids, to see whether which chemo will work with these patients and which will not. And we have some kind of biomarkers, genetic biomarkers that can predict for some targeted therapy, but in general, there are not many good biomarkers that tell us which drug will work in which patient. The main problem in the past with organoids was that the procedure is quite long, and of course we cannot wait for months to test and then decide, okay, we will start a patient to treat now. So what has been changing the last years is that the procedure has gone faster, so we can develop organoids in a couple of weeks. And also there are now multiple screening robots that can test multiple drugs at the same time within organoids. The main problem with organoids, of course, is it's not the real body of the patient. So the immune system is not there. It's not the same stroma. Of course, you can add immune cells if you want, but still it's not the same as a patient. So there are now more and more publications that try to look, okay, is there a correlation between responsiveness in the organoid system versus the patient? And I think in the future it might be a system that could be even implemented in routine clinical practice to test for some drugs to see which drug we have to give to which patients. But at the moment it's currently mostly research that is ongoing.